certainly closer to morning than it is to evening. Can't sleep. I understand that. Is there anything I can do to make you more comfortable? Yeah, just give me a sec. It's always so cold in here. Not a lot of blankets, but quite a few sheets. Let's just start with this all folded up. That way, if you need a little more warmth to be dispersed, you can pull up on this end, and if it gets a little too warm, you can just fold the top down, right? It's a pretty comfy tip. So, let's take a peek at your chart. What are you in for? Makes it sound like you're in prison. What are you staying here for? Might be a little better. Let's see. Okay. Good to know. So it looks like we are supposed to be doing some intermittent testing just to check up on everything. So it's been a pretty dead night, so I can do that with you right now. That way no one has to wake you up later. Would you mind just confirming your name and date of birth? Okay. Good. And your preferred name and address? Excellent. And do you know what day you were admitted? Good. And where are we at in the hospital? What floor? What section? Alright, so we are oriented to time, place, and person. Very good. So let's go ahead and just grab some vitals from you. I'll start with taking your temperature. Do you mind if I use your legs here as a little table? I won't be putting everything on you, just anything I need within reach. Alright, perfect. I won't be putting it actually on you, just more on your bed. There, just like that. If I could have you just lift your tongue to the roof of your mouth for me, and actually before you do that, you mind if I touch you and perform this examination? Alright, I know it's sort of implied, but I just want to make sure. So, you could just lift your tongue to the roof of your mouth. There, tricky things. And go ahead and just lay your tongue on top of the thermometer probe there. Good. And let's go ahead and just wait until we hear that beep. Into the sterilization pile we go with that. Good. Good, so let's go ahead and move on to taking your pulse here. Mind if I use this arm? It's just easier for me to reach. And I just have my forefinger and second finger right below the crease of the wrist on the thumb side. Good. Good. All right, so pulse and respiration rate looks pretty good. Now, before I have too many numbers to juggle, note that down. And we have a heart. Measure blood pressure. These big manometer. And I'm going to use you as the table. Here, let's get this all organized. So I have my dial here. And I just like to tuck the dial into the cuff. Makes it easier, gives me a free hand. Let's see. Okay, so the valve is closed there. We need one of these. I could just have your arm here. Good. And if you could just relax that, I'm just going to put the dial in the cuff there. Go ahead and grab our bulb here. And I'm going to place the diaphragm of the stethoscope right in the crook of your elbow here. Let's go ahead and check. Allow that to fill up. Let out the air a little bit. And there we go. Good. Let's do that one more time. Let me close the valve. Slowly out. There we go. I'm going to leave that open. Take the diaphragm off there. And the dial. Take this off. And take this out. Good. Just put this back. We are well within normal limits for that. Last thing I want to do here. I have a little oxygen sensor here, one of the little clips that I just put on your finger. And I could have you just stick out your finger here. Go. And then let's see. So I'm gonna grab my pen light, I think. Start with that, and I have my Stethoscope. Let me take a look. Yeah, there we go. Good, good oxygen saturation. Now I'm going to unclip you and write that down. So we are going to start with my pen light here. It's a little bright, but I want you to do your best. Do not blink. And if you could look right here at my finger. Just look right at my finger there. Good. Just want to check your pupillary response here. And luckily, since the room's pretty dark, it is pretty easy to see the eyes, see the pupils dilate and constrict. Good, okay. And I'm going to replace my finger with this here. Can you take a look at this light here? Can you follow this light using only your eyes, without moving your head? Just do the best you can. Even if my light goes a little out of your visual field, do the best you can here. Good. Alright, so this is testing the cranial nerves 3, 4, and 6. We have oculomotor and trochlear and abducens. Good. Good. Now, can you focus on the side right here? This comes in and out. Good. In and out. And in and out. Good. Other side here. You could just keep looking at this. In, out, and in, out, in, and out. Good. Now, if I could have you look at my finger here, then look at the light. Look at my finger. Look at the light. Finger. Light. Light. Finger. Look at the light. Finger. Good. Look at my finger. Look at the light. Finger. Light. Excellent. And if I could have you just go ahead and follow my finger around. Good. Just track my finger and then look at the light and track the light. Good. Just keep looking at the light, then look at my finger. Good. Excellent. Very good. And look at the light. There we are. Excellent. Good. Right. You can let your eyes relax there. Now let me grab my reflex hammer here. We're We're going to use this for a couple of applications. Firstly, I have a couple of hidden compartments here. I have a pointed tip, and I also have a little brush here. And I would just like you to tell me whether you feel the little pointed tip or the brush. Mind if I just test these on your jaw so you know what you're looking for? So this is the pointed tip. Good. And this is the brush. Right? So just let me know. Which one you feel. Right? The brush. Good. The brush. Little tip. Good. Brush. Tip. Tip. Good. Brush. Tip. Tip. Brush. 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 Very good. So I'm just going to do that on your arms here. So let me know whether you feel the brush or the tip. Brush. Brush. Pointed tip, good. Tip. Tip. Brush. 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 Excellent. So let's put this back. Would you mind just telling me, are there any of those spots that felt more or less sensitive than the others? Good. So it all felt relatively equal. Excellent. Let's go ahead and do some reflexes while I have our reflex hammer out. So I'm just going to get your arms here first, since those are most accessible. So if I could have you just lay your arm across your lap here, and I'm going to be striking the hammer behind the arm here. Let the arm relax here. And we are just going to, just like that. Good. If I could have you lay your arm out, I am going to hold your elbow here, and I'm going to tap on my thumb, which will be in the crook of your elbow here. Now just let the arm relax here. Let's do one more. There we go, just for symmetry's sake. And the other arm here, I'm just going to reach across you. Okay, lay this over your lap. Good, and there we go. And let the arm relax. And I'm going to hold your elbow here. Okay, so triceps and biceps reflexes, respectively. Look good here. So next, I am just going to put my arm underneath your leg here. That way I'll get a little bit of the leg to flex. I'm going to test your knee-jerk reflex. So just go ahead and under here. And then we're just going to... Here we go. And the other side. I can see that. There we go. Good. Put that back. And I'm going to put your lower leg a little bit. We're going to cross it over on the other leg so that I can get the ankle jerk reflex. I could take your leg here. We're just going to move it over here, crossing your legs. You just move this leg over here, add the ankles on this side. Let me just readjust your sheet here. Are you a little too warm, still cold, or are we doing all right temperature-wise? Good. Just let me know. And let me record that down. Have you open your mouth for me real quick, and we're going to take a look around in your mouth, but more what I'm looking for. Just stick out your tongue. Good. More what I'm looking for is that we are doing some neurological tests, so if I could have you say, ah, there we go. Good. Just gonna have a look. So we are currently working on the glossopharyngeal and vagus nerves. I'll have a second test in just a second. Okay, teeth look good. The tissues look good there. Can you lift the tongue to the roof of your mouth? There we go. Good. Looks good. Put that in discard. If I could have you stick out your tongue, and can you move it to one side, the other, up and down? Good, so hypoglossal nerve looks good. Can you take a dry swallow for me? Excellent, good. I took a bit of a detour there. So we did our glossopharyngeal and vagus, then our hypoglossal, and then finished up glossopharyngeal. So, what do we got here? What do we have here? Let's test. Cranial nerve 1. I've got a scent in this little cap here. You could just tell me what it smells like, right? It's going to be pretty easy, but it will be quite strong. Just tell me what that smells like right there. Yes, isopropyl alcohol. That one is so distinctive and so strong that unless you really had something going on with your olfactory nerve, it's rather easy to pick out. Take just a little peek in the ears. Got the otoscope. I grab a new speculum. Let's see. I'm just going to snap that on there. Okay. Light's a little weak. Might have to change the batteries, but this otoscope can be quite tricky. Sometimes if it gets jostled right here is where the batteries go in, so if I hold on to here, sometimes it gets a little jostled, but there we go. It just needed a moment to warm up. So I'm gonna reach over you here and take a little look in your ear, right? Go up and back. There's not anything in particular anyone has noted when looking at your ears. I always like to make sure before we test the hearing, just to see if there's any external impediments, if you will, that would affect the hearing. The other side. Usually it's something rather simple, like issue with the serum production, more specifically an excess, but some people might have an injury or infection. I just like to make sure before I get in there and test the hearing. Everything clear out there. Everything's looking pretty clear. That side as well. Here. I need to put that with the sanitation. So, there weren't any physical reasons that I saw with the otoscope that we might have an impairment in hearing. You haven't before, and there hasn't been anything cited with the otoscope by any other of our medical professionals. I do like to be thorough, though, just to be sure. So I am going to do a very simple test here. I'm just going to be rubbing my fingers on one side or the other. I'd like you to tell me when you can hear this and what side, which you can just answer left or right, and that takes care of both answers. Good. Good. Yep. Good. Yep. Good. Good. If you could tell me when you hear the sound go away, right? Just tell me when you hear it stop. Good. 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 Good, and tell me when you hear it start. Good. 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 Excellent. Very good. So, just going to move my otoscope here. And then we are just going to test your shoulder movement real quick. So if I could have you shrug your shoulders. Very good. And then I'll put in the otoscope. Rather, the stethoscope. Closer, yeah. And if I could have you just breathe normally here. I'll take a listen to your heart to start with. Good. We had atrial, pulmonary, tricuspid, and mitral. I'm just going to flip to the bell of the stethoscope here. Just keep breathing normally. Good. And this time I am going to prompt you when to breathe so that I can listen to your lungs. Take a deep breath in and out. Deep breath in and out. Good. Deep breath in and out. 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 Good. So I'm just going to lift the sheet here a bit. Just the sheet. And I'm going to take a listen to your abdomen. Just didn't want to do it through all these layers here. And just breathe normally for me. Listen all around. Good. Taking a couple seconds to listen. let's do some palpation here. So I am just going to use one hand real quick to feel around the abdomen. And then we'll use a two-handed approach. And I'm going to have you do some breathing with me. That one can be kind of unpleasant, so it helps to have something to focus on. Okay, now two hands. If you could take a deep breath in for me, and out. Nice and long. Good. Deep breath in. And out. Deep breath in. And out. Deep breath in. And out. Last one. Deep breath in. And out. Try not to push the air out of you, so only palpating while you're exhaling. Good. Let's put the sheet back. Here we go. That is indeed everything, although there had been a bit of a concern with your heart rate and your blood pressure, at least when you came in. So now that we've kind of settled in, getting a little sleepier, I hope, let's go ahead and test that one last time. We're going to start with the blood pressure. So that one's more noisy and more involved. And after I leave, hopefully you'll be going back to sleep. Using you as the table here. Getting this all ready. Clipping in my dial in a second. Stethoscope. Just put that on your arm. Here comes the dial. Put that in there. You hold on to that. And we have the stethoscope in the crook of the elbow there. And did I leave this open? I did. Let's go ahead and close the valve there. Right, so I'm just going to out the air a little and all the way. Good. Let's try that one more time. know this is one of my least favorite parts about being seen at an office or at the hospital. Okay, let that all the way out. Luckily it doesn't last that long, but it doesn't feel awesome, yeah. Take the dial off. And then the cover. Yeah. And if I could see your arm here, there you go. We're just going to wait a moment. I got my watch running. Okay, good. Okay, so respirations went down and the pulse did go down a little bit. Which is good. Good. So both of those ranges between the pulse and the respirations and the blood pressure were all normal. We just want to make sure that that stays normal. So that is going to be the end of my examination. Anything I can do for you before I go? Yeah, let me just straighten this out here. Do you need any more of the sheet? This part comes up. There. That's a little more diffused. It's not all concentrated at the legs here. Very good. Anything else I can do for you? Alright, let me just sign off on your chart and put that back. Good. You are all ready, and I don't think anybody else will deliberately bother you until the morning, alright? Hope you get some good sleep. Okay? You have your call button? Okay, let us know if you need anything. I hope that you have a whale of a night and a good rest of your night. Thank you. Sweet dreams.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of a day and a good rest of your